This is Dr. Rushi Deshpande, and I am the Director Critical Care Nephrology at Sir H. N. Reliance Foundation Hospital. Today is World Kidney Day, so on behalf of all of us at Reliance Foundation Hospital, I wish you all a very happy and healthy kidney future. So, today we thought we'd take this opportunity to interact with all of you as to what is normal kidney function and how can we help preserve it the best. What we need to understand is basically kidneys are like silent organs. They are not somebody who will shout and say, "Oh, I am in pain, I have a problem, please come and attend me." You know what I'm referring to. So it's not like a chest pain or something that you will get if you have a kidney disease. So what are kidneys and where are they located? So all of us are born with two kidneys and they are in our abdomen. Okay. So these kidneys are located one on each side of the spine and they do the job of filtering our blood of all the waste products and maintain the body internal environment as close to normal as possible. So, if I ask you how much water you had yesterday, you might not remember. Even I don't know. Why we don't need to know is because our kidney senses how much fluid should be in our body and anything extra is removed by the kidney. You understand? So this beautiful physiology of the kidney maintains so many internal functions. So these kidneys, which are there on in the abdomen, they are connected by pipes called as ureters to the bladder, which stores the urine till we find a suitable spot to release it. Right. So that is a normal kidney function. Now, kidney does not only do the job of producing urine and removing the waste. It is also an endocrine organ. It makes important hormones like active vitamin D and erythropoietin, just to enumerate a few. So, in any patient with kidney disease, what do you see? You see that they have high blood pressure, they have bone pains, they have very low hemoglobin, and that happens because these patients have decreased production of these hormones. So, kidney is a synthetic factory, it's making the hormones. Kidney is a metabolic factory, it's removing the waste products by filtering them out from the blood. And it's also a metabolic factory in the sense that it's balancing the levels of all those micronutrients, be it sodium, be it potassium, be it calcium, magnesium, all of these are balanced to an absolutely perfect level by your kidney. Okay, even maintaining the acid base level in the body, so maintaining sugar that we don't have acid in the body extra or very little acid in the body, so both are not good. So maintaining the acid level at the perfect level is also the job of your kidney. So people commonly ask me, what is a normal amount of water I should drink? So when it comes to water, we don't need to remember, like I said before. Why? Because our kidney senses how much fluid we need, and it makes sure that our thirst mechanism helps us drink that much fluid. But in our day-to-day lives today, we should at least ensure that we have a couple of liters of hydration a day. At least 2 liters a day is a bare minimum that we should be maintaining our hydration at. This does not apply to kidney patients. They will be guided by their doctors in as to how much fluid they should take individually based on their disease. But for those without kidney disease, yes, this is a level of hydration that should be maintained in the body. Now, when you look at kidneys, now I told you they are silent organs, but they are doing so many functions like maintaining the blood pressure, removing the waste, managing the fluid balance, managing the waste balance. How are we going to check it that they are normal? Suppose you want to go and find out, are my kidneys functioning well? How do you find out? Well, very simple basic tests in the kidney, in the blood and the urine can tell you whether your kidneys are functioning or not. First and foremost, blood pressure. Like I said, blood pressure maintenance is a job of the kidney. Kidney is responsible for making the hormones which maintain the blood pressure. Understand that. So if the blood pressure is high, elevated, which is called as hypertension, it is imperative that the kidney function is checked and made sure that the patient does not have a kidney problem. So any patient who is diagnosed as hypertension for the first time must have a kidney checkup to ensure that they have normal kidney function. So the basic test for the kidneys that I would say that should be part of any routine health checkup should be a urine routine, and that should tell us whether there is any blood cells or any protein in the urine. These are abnormal findings. If they are present, you should be consulting a kidney specialist. The other thing is the blood test. In that, first we measure the level of waste products in the body. So the waste products that we commonly measure are the urea, the blood urea nitrogen, and the creatinine. These waste products, if they are elevated beyond what is normal in the body, they should be immediately assessed for uh, any kidney disease by a nephrologist. Now, what is normal is also a matter of debate, because I'll tell you a simple example, something like creatinine. Right now, when a person donates a kidney to their loved ones, they are left with one kidney, and in spite of that, most of them have a creatinine of close to 1.4, 1.2. How is that happening when in your lab reports it's saying zero point 0.8 to 1.3 is normal? That is because what is normal is different for each individual based on their height, their body habitus, their weight, so many things. So it is even a superior test to know whether or not the kidney function is normal or not is a cystatin C. A very simple blood test can be done at any hour of the day. A cystatin C can tell you whether your kidney function is normal or not. If it is normal, the waste products are normal, the urine is good, and the blood pressure is not there, you are very unlikely to be having a kidney disease. So why is it that all of us now see that so many people known to us are having kidney problems? Is the number of kidney patients really increasing, or are we just better at detecting them and treating them better? I think they are increasing, and that is because a large component of the kidney diseases today comes from the metabolic disease. So, metabolic syndrome, we are now unfortunately the diabetic capital of the world. Diabetes is the commonest cause of kidney problems in our country today. In addition to that, high blood pressure, which is uncontrolled, and so many other kidney diseases, they all contribute to this increasing uh, pandemic of kidney diseases, which is really expanding in our country, and we should try our best to control it, because it's very difficult to treat all of them if they end up having serious levels of kidney dysfunction. So, what can be done to prevent kidney diseases? To prevent kidney diseases, the most important thing is early detection. I'll say that again, early detection. What does that mean? That unless the kidney problem is detected early, the doctor treating you will not be able to reverse it, even if it was reversible, and will not be able to maintain it and prevent you from going on to dialysis or transplant if you come very late to the nephrologist. So it is important that early detection is followed. How do you detect early? I explained to you. Just do basic tests, urine and blood test, and maybe an ultrasound, and that's more than enough to know whether or not your kidney function is good or not. So, should you really be doing that very often? No. Unless you have a family member, a first grade family member, first degree relative with a kidney disease, you can be checked for kidney problems once every 5 years. But if you have a family member with a kidney disease, then you should be checking it once every year. If you have diabetes or blood pressure or kidney stone disease, you should be checking your kidney function once every year. Okay? Early detection is the key, and early detection will help us to treat you early, and early treatment is the key to success. Remember, when I explain to patients, I tell them, God has given our kidneys the capacity to repair but not to regenerate. Now, what does that mean? Suppose you have a burn and your skin is scalded, the fresh skin comes over it, and there is complete healing. But that does not happen in the kidney or the brain or the heart. These are organs which don't have the capacity to make new cells. They can only repair. So when is repair possible? When the cells are still alive but not well, right? So these cells can be taught how to be repaired, but you can't make new cells in the kidney, at least not today. Okay? So it is important to early detect the problem, and so that you can treat it in the right way. At RFH, we have a complete program here for all patients with kidney problems, right from early detection, prevention of kidney disease, to the most advanced treatments for kidney problems, be it the dialysis program here, which includes the nocturnal dialysis program, the critical care nephrology, which I am the director of, runs an excellent dialysis programs for all patients who need dialysis in the ICU. And there are different forms of dialysis which we shall not get into right now for paucity of time. But a lot of evolution is happening in this branch of critical care nephrology, and we are really able to help patients with kidney problems in the ICU get better to their maximum potential. At RFH, we also have a very thriving kidney transplant program, and uh, it is really helping a lot of patients who have lost their kidneys and who are ended up on dialysis to get back to a normal and active life. And um, the supportive environment here in this hospital is helping the nephrologist provide optimum care to their kidney patients and ensure very good outcomes. I wish you all a very happy World Kidney Day, and I hope and pray that all of you have good kidney health. And please take care and check yourself, because, like I said, early detection is the key to treatment in kidney disease. Thank you so much for your attention.